Hello everyone, welcome back to my channel. I'm Dr. Sharona Dayan. For those of you who don't know me, I'm a board certified periodontist practicing in Beverly Hills, California. And a lot of my patients now are coming in with teeth clenching and headaches and gum disease because their stress levels are so much higher. And it's really natural right now during the pandemic for us to have some higher anxiety and stress. You know, things that just we did automatically, we have to think about. You know, we're in the elevator. Oh my God, I pushed the button. Is it bad that I pushed the button? What's gonna happen? What would the experts say? Who are the experts? Is there gonna be a treatment coming out? You know, so many things that are running through our minds, even when we're doing a basic task like riding in an elevator. So today I wanted to share with you a breathing technique that I teach my patients to help calm themselves, especially before bedtime. And then also just throughout the day, if you can practice this and develop good breathing techniques, you might find yourself being able to control the anxiety and the stress much more the more you practice. So I teach my patients, always breathe through your nose. You really should never be breathing through your mouth unless it's an emergency situation where your nose is completely stuffed and you cannot breathe through your nose. And that should be for a short period of time, not day-to-day chronic. So what we want to do is close our lips, put the tongue on the roof of the mouth. The teeth should be slightly apart, so not touching. And you can put one hand on your chest, one hand on your rib cage, and breathe in through your nose for 4 seconds and out for 6 seconds. And as you breathe in and out, you should feel your rib cage expanding, which means you are engaging your diaphragm. The diaphragm is a muscle that's part of our autonomic nervous system, but it is connected to the brain directly via the phrenic nerve and gives messages to the brain. So when you engage the diaphragm and you're breathing slowly, 4 seconds in, 6 seconds out, 6 breaths per minute, this sends a message to the brain to calm down. So let's practice. Mouth is closed, tongue on the roof of the mouth, teeth slightly apart, and we're going to go. And even just after a few breaths, you can just feel the body and the brain starting to relax. The reason that we want a longer exhalation is because oxygen is delivered during the exhalation. So we want to give the body a little bit more time to get that wonderful, amazing nutrient oxygen out from the circulation. So practice that 15 minutes before you go to sleep. You might find that you'll have an easier time falling asleep. And if you are feeling a little bit stuffy or congested, I have some suggestions for some tools that you can keep at home to keep that nose working. The first is the neti pot, which is an ancient Ayurvedic cleansing system. So we have a pot that kind of looks a little bit like a teapot, and you fill it with water. If it's tap water, you want to make sure you boil it first, or you can use bottled or filtered water. Then you're going to put a little salt packet to give the water a little bit of saltiness and cleansability factor. And then the way that this system works is this nozzle goes in through one nostril and then it comes out, the water comes out through the other nostril. So it cleans everything in its path. It removes the dust, the pollen, things that you just might be allergic to. And I recommend that you do this before you go to sleep at night so that you can breathe through your nose as much as possible while you're sleeping. You'll go into a much deeper restorative sleep when you are breathing through your nose at night, not through your mouth. Now, if you're on the go and you can't carry that pot with you everywhere, there's a neti stick that you can also purchase. And this basically is like a strong peppermint stick. And breathing it in helps to clear the nose. Along those lines, I love using pure essential peppermint oil. Just to make sure you get a nice high quality one, and you put a few drops on a Q-tip and you insert it inside the nose up just till past the nostril. Just clean it a little bit and you're gonna see your nose is gonna totally open up. And this is also gonna help you smell better because we get a lot of cues from our environment about safety through our sense of smell. Like if a food is bad, we can smell it and then we don't eat it, so we're not eating poisonous food. And this also just helps to relax the brain because you're giving the brain important information about the safety of your surroundings, and that has a calming effect on the brain. And then I want to also mention mouth tape, which you may or may not be familiar with. Mouth tape is commonly used by athletes at night. It's used pretty widely in Europe and Australia, and it's getting a little bit more traction here in the United States, especially among, like I said, the athletes who perform so much better when they're breathing through their nose. And this is a special mouth tape that has these micropores, okay? And you just stick it over your mouth at night. And you might wake up feeling like you got the best night's sleep. This is hypoallergenic. This is a brand called Somnifix, but there are several good ones on the market. It's hypoallergenic. It peels off easily in case you need to peel it off. And I highly recommend mouth taping at night for a good, deep, restorative sleep. So those are some suggestions that I hope you found useful. Remember that nasal breathing is really the only healthy way to breathe. Mouth breathing has a lot of bad side effects that I can get into in another video. Be sure to practice the breathing technique. You want to breathe slowly, you want to use your diaphragm, and try it before you sleep at night, and let me know how you do. Thanks so much for watching.